It's my pleasure to introduce Rich Dennis. He's been at Willamette, now I'm reading, of course, since June of 2006. After retiring from the Oregon State Police after 27 years of service, he came to Willamette, and after some time here, he was promoted from the Safety Education Coordinator to the Assistant Director of Campus Safety. So he'll be talking to us about the automatic external defibrillator that we have installed, and that this is ours, actually, right here. He's brought it in so we can see it, and he'll show us how to use it. Talk a little bit also about general concerns for first aid and how to respond to emergencies, and then we'll have some time for questions. Thank you.
Thank you, Jim. Can everybody hear me okay? Not too loud? Okay. Thanks for having me here today. First of all, first question is, how many of you are trained in CPR? How current are your cards? That's the next question. They expire after 2 years, so you might want to get retrained if you're expired. However, you've been trained, and in the state of Oregon, we have a law that protects you, the Good Samaritan law. So if you're trained and you don't go any further than what you've been trained, then you can do this first aid. So how do you know when someone's having a heart attack? Somebody tell me? Fall down dead. That's a pretty good indication, yeah. How about the color of their skin, or what they're doing before that happens? Pain in the arms? Pain in the chest? Huh? Mm-hmm. Not necessarily women. That's true. Some women do, though. Yes. Nausea, sweating, not feeling good. Their color, their skin starts to go ashen. If somebody's having those symptoms and you see that, somebody, one, needs to call us, Campus Safety First, because we know where you're at. Then somebody should probably call 911 to get the EMS here. And then somebody needs to get that person on the ground and make them comfortable. And monitor their vitals while we're getting here. And if they lose consciousness, you're going to check for pulse, breathing. Someone better go get this AED out of the cabinet. That's what this is for, okay? So this is yours. The only AEDs we have on campus are the Zolls. Every one of our AEDs are the same. So if you're in a building and you know where it's at and you know how to, you just pull this out and start using it, because they'll tell you exactly what to do. In the cabinet out here are some things that, and I'll go through this in just a second, are some things that you may need. You got a breathing mask, gloves, all kinds of things in this packet. Here you have some more tools. If a man goes down and he's got a really hairy chest, before these pads fit, you gotta shave him. You got to get those, not his face, his chest. She's over here laughing like she's gonna shave him. Shave that chest so you get a good adherence with these pads on that chest, okay? There's also a pair of scissors in here. If you got somebody with tight clothing on, you need to get to them, man or woman, you cut their shirt, cut their blouse, cut their bra, whatever. You get everything off of them, out of the way, and use these tools that are in here, okay? That's important to make sure that when you stick these pads on these people, they're gonna stick, okay? Now, once you pull this out of the cabinet, there's an alarm on that cabinet. Don't worry about it. If you're pulling this out to save somebody's life, you just pull it out and let the alarm go off, okay? We're on our way. If I'm here during the day, I'm coming. So I will be here to help you. You open this thing up, and this is already plugged in. These are the pads. These pads will tell you exactly how to put these pads on, this package right here. You just tear this baby open, and these are old ones, so I'm using this. Okay. You got 2 pads, okay? And the machine will tell you exactly what to do. You're gonna stick this right on that sternum. These pads go right there. If it's a woman, it goes on top of the breast. The other one on the other side goes under, and the pictures will show you that. Just stick it right there. And this is also your target zone for those of you who do CPR. This is where you're going to put your hands, and the machine will tell you exactly what to do. It tells you to give compressions. It tells you it'll walk you right through. There's little pictures on this thing, and it'll tell you exactly what to do. Okay? So if you start this bad boy.
Unit, okay. Adult pad.
Can everybody hear that?
Stay calm. Check responsiveness. Call for help.
You've already done that, hopefully.
Attach defib pads to patient's bare chest.
Okay, so now it's reading. Okay, they'll be reading that patient, and there's a little button here.
Attach defib pads to patient's bare chest.
Okay, we're not doing that today. Stop talking. Okay, so it'll tell you and that's at that time that machine is reading. If there's not enough heart rhythms going through this thing, it'll tell you not to shock. You just keep doing CPR. Okay, there has to be some kind of heart movement for that machine to read it, and they'll tell you to shock it. So there's a button here. If it tells you to shock, it will tell you stand clear. You're going to tell everybody to get away. Don't let anybody be touching, because you're going to get a little shock too. This thing it'll shock as many times as it takes. Okay, so this machine is really simple. I mean, it tells you exactly what to do. If you have to open this thing up and turn it on, it tells you exactly how to do this, okay? Now, if you have a larger person, a larger man or woman, these will pull out and fit better, okay? Your first place is going to be right here on the sternum, and then you have to stretch it to make it better fit to where it needs to go. These are made to do that, okay? These Zols are very, very good, and it's very easy to use them, okay? Very easy. So don't be afraid to open this thing up and shock somebody if it tells you to shock them, okay? Pretty easy. I mean, it's a really good machine, and luckily we've only had to use it once on campus. There are 18 of these now on campus. When I first got here, there were 2. There was one in our patrol car and one in Sparks. That was the only 2 we had on campus. And now we have 18. So they're not everywhere, but the maps will show you where they're at. So when you're in a building, you might want to check to see if one's around where you're at, just in case. I am responsible for keeping the pads current. I'm also in charge of making sure these batteries are renewed every 6 months. I put new batteries in these things every 6 months. So I do it more than what the manufacturer says. They want them changed every 2 years. I do it every 6 months, just because I don't want something to happen. Okay? Other first aid questions. Somebody's having a stroke. How do you tell somebody's having a stroke? What? Have them stick their tongue out, put their arms up, whatever. Okay, and it'll affect that side. I've responded to a couple calls where somebody has passed out. They just passed out. What do you do when somebody just passes out? Huh? Pardon me? Make them comfortable, stay with them, make sure they don't start having seizures. If they're in a crowded space like this and somebody has a seizure, please get them away from chairs and get them away from a table, because they could hurt themselves more serious, hit their head, break an arm, break a leg, because those seizures are so violent. You need to get them away from anything that might hurt them. Okay? Any questions about the AED? Yes? Oh. Oh, okay.
Hi, this is Gwen Ellen, and I have 2 quick questions. One is, are those universal, so wherever we would find one, it would be the same?
Yes.
Not only off campus, someplace else also?
Other AEDs are different, but the technology is still here. They will tell you on how to use it,
Okay.
and they should have pictures and everything like this one does.
And when you pull it off, does it send a message to your
Nope.
office? Oh, okay.
Nope.
I misunderstood that. Thank you.
No, there's no, we don't get notified with someone, the only way we're going to get notified is somebody's calling us for medical assistance. There's another question down
Question over here. Here. Right here.
Oh,
My name is Joel.
hi, Joe.
There's a difference between cardiac arrest and having a heart attack. Would you use the charger if the person isn't in cardiac arrest?
You're better off putting this on and let the machine read, and it will tell you either shock or don't shock. So if you think somebody's having a heart attack or they're in cardiac arrest, I'd put the machine on, and I'd monitor their vitals and just wait for EMS to get there.
I was told once by someone like you that it doesn't make any difference what the intervention is. If the person's in cardiac arrest, they're dead. So you can't hurt them.
Right.
Anything
right.
could be an improvement.
Well, exactly, and that's why you put the machine on, because you're not going to hurt them. So, right here in front.
Over here, way back here on this other side. Hi, my name's Karen.
Hi, Karen.
Okay, so I had a friend who had a stroke, and the only thing that anybody knew was she was walking, and then she was down on the ground. No other signs. So, I mean, before she went down.
Right.
So it was one of those awful ones back in the head.
Okay.
So I would think that the first thing you should do is check for a pulse and call for help,
Well,
no matter what happens.
Absolutely. You absolutely do that. Yep.
Okay. And so when they show on TV that they're doing shocks and stuff when someone has a flat line, is that just pretend the person has would have to have some sort of heart rhythm before it would be effective? Is that what you're saying?
Is there a doctor in the house? Where's Jim? Maybe you can answer that question.
So this machine is called a defibrillator because the only heart rhythms that it works on are the only rhythm is ventricular fibrillation, which can occur when there's a heart attack. So one of the forms of cardiac arrest is ventricular fibrillation, and this machine is designed to reestablish normal rhythm. If there's a cardiac arrest and it's actually a flat line, the defibrillator won't do anything.
Right.
It won't reverse asystole or no heartbeat. But it doesn't. On the other hand, it doesn't hurt to try it.
Right.
There's no harm. But
That's why, yeah.
but it won't be effective. But because it is so effective in treating ventricular fibrillation, that's why these are made available, because they do work and they'll save somebody's life.
Right.
Hi, this is Cassia, and I think that I have answered my own question. I'm down here in front.
Oh, okay.
So, when you remove these defibrillators from the wall, they operate on just straight batteries. You don't have to plug them in anywhere, right? So you can cart them around. Because otherwise I was thinking, well, if they're stuck to the wall and they need electricity, then you have to move that body all the way to wherever it is. And I said, that doesn't sound practical to me at all.
No, this is mobile.
That's it.
And we have one in our patrol car, and you just grab the handle and run in and hook it up. So.
Okay, thanks.
Okay, Pat here. If you're doing CPR on a person, and that I'm assuming that's the first thing you do. When do you know to do the other thing?
Okay, if I'm sitting there doing CPR, let's say I'm doing CPR on somebody, and I tell somebody get that AED. Somebody goes and gets the AED. I'm still doing my compressions, and I'm not going to stop until you've got that pad open and you've got it all set up. Pull these papers off and getting ready to stick it. And when you're ready, I'll say, okay, I'm going to stop. You stick that sternum pad on, and then you stick those other pads where they're supposed to be, and then we hit the button, and the machine will tell us I will wait for, maybe 10 seconds before I start CPR again, because I want to make sure that that heart's beating. So I'm gonna continue my CPR until the machine tells me otherwise. So that's why it's got that little target right there. You're just going to keep doing it, okay?
I'm wondering how strong that shock is, say, relative to a taser or a automobile spark plug wire or a farmer's electric fence or something.
Well, I'd ask for a volunteer, but that probably wouldn't work. I know that it's strong enough that it will shock that heart back into, hopefully the first time, back into rhythm. So it's a pretty good jolt. And if you're sitting there next to it and you're touching that person and if I'm doing CPR and somebody hits that button to shock and I'm doing CPR, I'm probably going to be flying backwards because it's going to bite me. So that it gives a good shock. It won't kill you, but it'll shock your heart back into that. So, I mean, I guess I told my son to urinate on electric fence. It shocked him pretty good. It probably about the same one, so something like that. So anyway.
What will my pacemaker think of the shock?
Now, I've heard your pacemaker, it may read your pacemaker. I've never had to put one on anybody with the pacemaker in, and everybody's has a different kind of a setup, so I don't know whether it's going to read that. Doctor? Pacemaker?
Then it will, sense the pacemaker, but that's where you have to also do checking the pulse and checking the breathing, because
right.
the pacemaker can keep going even if there's a massive heart attack, the heart may not be beating effectively. So,
right. And if the machine picks it up, it'll say, go ahead and give it a shot.
Right. I think that's the way it's designed. So.
Right.
This is Barbara. In our apartment building, we've put one in the lobby, but there were a couple people in the building that said, "Hey, I have a DNR. I don't want anybody messing with me." So how do you deal with that?
Okay, so if I'm responding to an emergency here, and I don't know they have a DNR, I got to do my job. I'm going to try and save your life, and they can do whatever they want with me later, because I'm going to try and save somebody's life. That's a legal question, and something that I'm not willing to let somebody die because I didn't know they had a DNR. Sorry, that's just me. So do not resuscitate. Do not resuscitate. Yep. Yes, sir.
George in the back. Maybe I should know, but I don't know how to contact campus security, and I'd be happy to just put it in my phone.
Okay. If you got a cell phone, the phone number is 503-370-6911.
You may turn your phones on to do that.
And we have people there 24 hours answering that phone. So
it's on the back of our cars too.
yes. And unless you're like mine and it's worn off. So any other questions?
Yes.
Okay.
What's the average EMS response time to the campus?
We usually get Station 1, which is right downtown. They're within 5 minutes, usually. Now, if they're on another call, we may get the station at the airport, which is a little bit farther away, or even all the way out on State Street. But usually we have Station 1 right downtown, and their EMS response is excellent. They know our campus pretty well, and if something was to go down here, I'd respond, I'd have EMS get here, and I'd have my officer or somebody else get the fire department through these doors here and bring them right in. So their response is really good. Right here in front.
I don't think I can answer it on my. Hi, I'm Jackie.
Hi.
I'm just wanting to update no more mouth-to-mouth. Is that correct?
You do not have to give mouth-to-mouth. If you're old school like me, I'm going to give them 2 breaths. And in the AED box out here are 2 shields. There's also a mask in here. Giving them 2 breaths just fills their lungs, because now the new way is we just give them the 2 breaths, and you don't give any more, and then you just pump.
Oh, thank you.
2 deep breaths. So, and this lid here, I forgot to mention this lid. If you're training CPR, you put this underneath their shoulders, and it tilts their head back, and it opens their airway up, and that sometimes even helps them get that first breath coming back in. It opens it up and lets them breathe. So, Sherry?
Rich, can you tell people, since ICL meets in Waller sometimes, and they go to Gowdy, where the locations are of the AEDs?
Okay. There's no AED in Waller. There's no AED in Eaton, the Science Buildings yet, or Rogers. Smith has one, Ford has one, Gatke has one in the exercise science room. There's one in Smolin, first floor on the Walton side of the hall. Let's see, there's 18. Where are they all at? There's one in Law, there's one in Gowdy, there's one in the UC, there's one in the library. I'm working on getting one in, there's one in Atkinson. I'm trying to get one in the Science Buildings right now, and the museum. The museum does not have one. And those are my 2 goals, to get 2 more AEDs stuck in there. So.
If I could just follow up on that, Rogers is the overall name for what we might call Hudson. It's the music center.
Right.
So.
Right. Sorry.
There isn't one there.
Yeah. So there's nothing in Waller. So if you meet in Waller, the closest one will be either across the quad to Smith, or call us.
This is Jim.
Hey, Jim.
One of the things that it says to you when you're doing it, I didn't hear you say this, but maybe you did, I just wasn't paying attention, is clear or stand clear, I think.
It didn't go there because I didn't put the pads on.
Right.
So it does tell you, there's a little picture there that says the guy's going like this, you're going clear, and they'll tell you do not touch. So, but that is on there, but there wasn't hooked up to a pad. I was going to use you, but.
And I had volunteered, but no.
That was nice of you. Any other questions?
Coming. I'm coming, Jinx.
Where exactly is that one for this room kept, and how much do those cost?
This one is located right out around the corner. Is right out in the hallway, right there on the wall. Has an AED, and this will be put right back in there. That's what I'm going to do right there when I leave here. They run about $1,500, or with a cabinet, they're about $1,800. But you need to have them secure someplace. That's why I put them in a cabinet with an alarm on them, because people could walk away with these things. So.
Yeah, I just wanted to clarify which phone numbers to call in which situations. So if it's a non-life-threatening situation, somebody has fallen, has a laceration or something, but they're conscious, we call the campus safety number.
Call the campus safety.
If somebody looks like they're unconscious, well, if they are unconscious or they don't have a pulse, should we call both campus safety and 911 initially?
Yes, call us first, call 911 next. Somebody could be calling 911 EMS at the same time they're calling us, because, like I said earlier, we know where you're at. Sometimes the EMS responding may need to be shown where at in the building this is located. And we know where you're at. We know where every room is. So get us here first. We're trained. You know, it's like the young lady that I gave CPR 2 years ago. I mean, I got to her first and was able to give her CPR, and then EMS showed up. So get us there first.
Hi, I'm Karen, and I understood that you just dialed 911.
Nope.
But that's not the way it is.
These phones here now are just 911.
Okay, so we have to get our card out somehow and give that. I mean, that's That's difficult to remember, you know, when you're in emergency type thing. So you do not get the 911
No,
yourself?
we do not get, we will get a notification if it's from a phone in here, in a
Okay.
building, if it's called from
Okay.
an office. I automatically get a call or an email and a call saying, room 213 just dialed 911. So we're responding to see what's going on.
And there are some towers around with blue lights sometimes, and what are those?
Great question. We have emergency blue lights all over campus. If you push that button, that rings right to the campus safety office. We know exactly where you're calling from. It could be Ford, it could be the Sparks Center, it could be the Quad. We know where those phones are at, and if you've got an emergency, you just push that blue button, the blue light comes on, and we know exactly where you're at, and we're going to be coming to that location. So, and that phone is not only for medical emergencies, but let's say somebody's following you or harassing you. Most criminals know that what a blue light means. Blue light means cops. And so if they see you push that button, they automatically say, okay, cops are coming. They know. And we usually are. I mean, we're coming real quick like, so. Yes?
Thank you. My name is Jeanette, and I have a question about the DNR. I mean, if some of us are committed to that, should we be printing that on our name tags? Or, I mean, I think my question is, how as a group should we?
That's a really good question. I mean, am I going to respond to emergency and look at your name tag, or am I going to respond in what my mode is and go in to try to save somebody's life? I mean, am I going to look for a note that says DNR? I don't know. I guess that's I probably won't. I'm sorry. So, yeah, another question down here in front. Oh, okay.
This is Bill. On our back door here, there's a little hook with emergencies procedures. On the back door here, there's a little hook with the emergency procedures manual that has a lot of this. Is that updated periodically? And
we just updated that one, yes, and we'll keep updating that as needed. Yes,
because it describes lots of these, and the idea that you call both 911 and campus security.
Yep. We just updated that, and we'll keep updating it as things change.
Great.
Yep, there it is. Yep. Yes, sir.
Yeah, my name is Stephen. So what do you do anything to clear someone's throat if they're, like sometimes people get regurgitate? And
how many of you have heard the Heimlich maneuver? How many of you ever had to perform it? That's the best way. If somebody's choking, and the universal signs if somebody's choking, they're going like this. And if they look like they're going to go down, you give them support and get them on the ground, and then like you're going to give CPR, you give that upward thrust right below here, and whatever. And make sure you're not standing over top of them when you do it, because that cannot be fun. Just make sure.
If they're having a heart attack, is there a possibility they would be also choking on something from regurgitating something?
Well, that's a possibility. I've never seen it or heard of that happening, but I'm sure that's a possibility. So, but yeah, you want to try and clear that airway as quick as you can. So. Any other questions?
This is Jim.
Yes.
When I've taken these classes before, one of the first things they emphasized was be sure that you're in a safe place. If this person has been electrocuted and there's a live wire there, you sure don't want to be down on your knees resuscitating.
Absolutely. So, I don't know if you can hear me now. Yeah, you want to, before you rush in, you need to make sure you're going to be safe too, because you're not going to do that person any good if you walk in and get electrocuted also. So that's very good advice. Yep. Oh, one more?
Yeah, well, I'll just comment on the DNR desires of people and emergency responders. So in Oregon, there's a system that other states have now adopted, but Oregon was the first one, the POLST form, which is Physician's Order for Life-Sustaining Treatment. And so this is a form, bright pink. It used to be bright pink. Now they've eliminated that. But if you visited people in a nursing home, you may have seen these forms on the door. People put them on their refrigerators at home. So it's signed by a physician. It's an agreement that certifies that this person doesn't want emergency resuscitation, doesn't want life-sustaining treatment, to put on a ventilator or have a feeding tube. I think if in the ICL situation, if you didn't want to be resuscitated, you'd have to bring that form with you and carry it in your, I think that's the only legal form that the emergency responders can honor. Otherwise, some notation that something that you carry in your wallet or have somewhere, they don't know if it's current. They don't know if you've changed your mind. They just can't follow that. They have to follow their training now. So that's the initial resuscitation. Once you get to the hospital and other family members are there or whatever, they may be able to not continue life-sustaining treatment, but in the initial response, the emergency people have to do what they're trained to do. And
I have a question. This is Rosamond. When you open that green box, does it automatically turn on, or do you have a switch that you have to turn on?
Good question. Once you open this lid up, there's a little gray button right here. And once you're going to put these pads on these people, you press that button and it'll tell you exactly what to do. The adult pads, they'll give you time to put it in the places. Then it'll go to the next one like it did earlier. So yeah, you just have to hit that gray switch right here, and it's turned on. Another one down front.
Hi, I'm Jackie.
Again,
I'm the kind of
Jackie.
person that needs instructions more than one time. So let's say that you're starting, can you rewind it? Can you I need to hear that again. What do you do if you're not sure and you want to go back? That's my question.
It will talk to you. It will tell you what to do. If you haven't done something right, it will tell you what to do. It'll just keep repeating the same thing until you do it. Yep. Okay. Alice, no questions? Jeez. No more questions? Welcome. My pleasure. My pleasure.